The Center for Medicare Medicaid Services says that 1 in 5 Medicare patients discharged from the hospital are readmitted within 30 days. The estimated cost of avoidable hospital readmissions is more than $17 billion a year. Nationally, on average, a home health visit by a registered nurse costs about $135. But if a patient instead goes to the emergency room, the same services provided by the nurse at home cost roughly $1,800 at the hospital. That's according to the National Association for Home Care and Hospice. Shaunda Luken, Senior Sales Manager at Better at Home and Mederi Caretenders, explains how in-home care can provide both peace of mind as well as cost savings across the system.
The role for home health is to cut down readmissions to the hospital. It's cost effective to treat a patient in the home, but to have that relationship with a physician to where you're teaming up and actively taking care of their patients and being that extension of them in their home. So often these patients come in and they lie to their physician. Their hair is done, everything's in order. How are you today, Mrs. Smith? Oh, it's great. Are you taking your meds like you're supposed to? Oh, of course. They're not telling them I forget, so I just don't take it. They lie. They're so afraid they're going to be removed from their home that we are their eyes and ears in the home. When we go into a patient's home and they've got their command center and they all have it, it's a lazy boy next to a side table in front of the TV with their daily meds, their lunch, anything they could possibly need. We're finding out, why aren't you getting up? What's really going on with you? These are all things that we're reporting back to the physician so they have a better idea and picture of what's really going on. The goal for us as Mederi Caretenders and Better at Home is to have our patients age in place gracefully. We know that to remain whatever independence they have is very important to them. I love to go meet the patients and explain to them what services we're going to be providing, and I can almost see the fear come across them when they know that, oh my gosh, my doctor has ordered home health care. How am I ever going to afford that? As soon as we tell them and explain to them, this is covered under your Medicare benefit, you worked your entire life for this, you deserve to have this service in your home, no co-pays, no out-of-pocket expense for you whatsoever, you can just see that relief wash over them.
Part of the Almost Family network of home health providers, you'll find contact information for Better at Home and Mederi Caretenders in Leesburg, Eustis, and the Villages when you click on the Home Health Savings Story Icon link on our homepage at yourhometownhealth.com.